I'm Robert Hone, I'm an ear, nose and throat consultant, and I work out of the Ashford Hospital and East Kent hospitals across all sites. The most common problem with your tonsils is recurrent infections, and this is usually in the form of recurrent tonsillitis. If you're getting lots of episodes of tonsillitis, missing school or work, it's probably worth getting a consultation to see whether you need them removed. On the NHS, there are specific guidelines as to how many episodes you need to have them removed, and we generally follow this in private practice as well. Infections in the tonsils can spread into the tissues around the tonsil and cause something called a quinsy or peritonsillar abscess. If you have a quinsy more than once, it is certainly worth getting your tonsils removed, as if you have them more than twice, you're more likely to get them again in the future, and these infections can even spread into the neck, causing deep neck space abscesses. Very large tonsils can also cause problems with snoring, and particularly in children, we often recommend removal of the adenoids and tonsils for sleep disordered breathing or sleep apnea. In adults, that is slightly more controversial and it can get complicated, so it's worth speaking to a clinician about whether or not this would be suitable for yourself. The other reason you may consider removing your tonsils is for tonsil stones, or if there's a lump on it, we may want to remove it to check that it is not a cancer. It is worth considering a tonsillectomy if you're getting recurrent tonsillitis or you get more than one episode of a quinsy. If there is a lump on your tonsil, you may wish to have this removed, or your clinician may wish to remove it to exclude anything worrying. Tonsil stones can be treated privately but not on the NHS. Last of all, if you do suffer with sleep disordered breathing or snoring, it may be an appropriate operation to try and help these symptoms, and that is the treatment of choice in children. Surgery for tonsillectomy is very straightforward, and it's one of the most common ENT procedures. It involves coming to hospital for the day, and you can usually go home the same day. Everything is performed through the mouth, and there are two main techniques for removing the tonsils. The first is an older technique which is generally employed in adults and involves removing all of the tonsil. The benefits of this are that the whole tonsil is removed and that there's no chance of it coming back, and this would certainly be recommended if you've had recurrent quinsies, because you need to open the space behind the tonsil. In children, coblation tonsillectomy is becoming more popular, and the reason for this is it tends to be less painful and you need less time off work afterwards. It involves dissolving the tonsil down and removing the actual tonsil tissue rather than the capsule of the tonsil. There is also a large reduction in risk of bleeding after the operation, which drops from around 5% to less than 1%. And this would be my treatment of choice for any children undergoing tonsillectomy. The main risk following tonsillectomy is bleeding. If you have a coblation tonsillectomy, this risk is reduced to less than 1% with a very small chance of having to go back to surgery. With an older style tonsillectomy, the risk of a bleed is 5% with a 1% risk of going back to surgery. It is also more painful than a coblation tonsillectomy, and the pain will actually get worse for a few days before it gets better. We'll make sure you have plenty of pain relief so that you can still manage to eat and drink, which we would recommend you do as normally as possible, as this reduces the risk of bleeding. The risk of bleeding does, however, run for 2 weeks, and if you did have any bleeding more than a bit of pink saliva or spitting out a little bit of blood after the operation, you would need to come back to hospital, and that would be your nearest accident and emergency department. There's a small chance of damaging your teeth and lips or your gums, as we do have to open the mouth and we use metal instruments in the mouth, but this is very rare. There's also a small chance of infection, which can cause a bit of increased pain and bad breath. It is normal for your tonsils to look white or yellow after the operation, and again, this will last for a couple of weeks while the area heals. If you have any concerns about your tonsils or would like to get an appointment, please get in touch with the Ashford Hospital and we'd be more than happy to make you an appointment.